ago. So what's happening is we're experiencing just a tremendous growth of technology. And I'm going to try and express that a little bit in the context of medicine tonight. We see many different disciplines of engineering and science coming together and affecting medicine in ways that are absolutely astonishing. There's actually a very interesting announcement today about a vaccine for prostate cancer. And what's happening is when there's a confluence of different disciplines coming together, you're seeing tremendous results. So I'm going to show a little bit about the context of what we've done within our company and the impact that can make in healthcare. And I'm going to talk a little bit about all these other technologies that are coming and really transforming medicine for the better. And up here, you're going to see a lot of images tonight. What you see here are 4 different slides. This is our software. This is software that's being developed by a team of people at our company, Sentinelle Medical, half of which are University of Waterloo graduates. In fact, a third of our company, about 150 people, are engineering graduates, including our CFO. Our head of finance in our company is actually a chemical engineer. So it's amazing the contributions. You can never guess where they come from. So maybe you can advance to the first slide, please. This is what motivated me. I graduated from systems engineering. I was not too sure if I wanted to go into medicine, and I started looking around at different programs. At the University of Toronto, please no booing, but there was a great program called Medical Biophysics, and there's actually a tremendous link between the University of Toronto and this program in Toronto, and University of Waterloo and this program in Toronto. A few of the faculty there are actually well, I guess you can never become X, but they're system design alumnus. And it just so happens that the skill sets that we learn at the University of Waterloo transfer so nicely into problem solving in medicine. It's because it really becomes a multidisciplinary approach to problem solving. And typically, a doctor is not necessarily prepared to take a good look at the problems that they're facing every day. And that's where an engineer can come in and see it in an entirely new light and bring together technologies to change how we deliver patient care. So my challenge was breast imaging and breast MRI in particular. So this on the right is a slice of a 3D volume. It's about a millimeter slice through a breast. And you see 2 little areas here. And these are in fact very small tumors. They're at a very early stage and they're very aggressive. And MRI is very good at picking these up. It's able to look at the blood flow that goes to these very small tumors. However, the standard of care now, mammography, which is X-ray, was not able to pick that up. So we were seeing 1 or 2 cases where all of a sudden this new technology, MRI, was able to see cancers that X-ray imaging couldn't. And then the challenge began. What do we do about these cancers? How do we biopsy them? How do we diagnose them? And that started forward a fairly significant program, which ended up employing about 50 people over about 8 years at the University of Toronto. Next slide, please. And what was really amazing, we were starting to see these incredible numbers. So on this bar, this is a number called sensitivity. So this is percentage of cancers that are seen by these different imaging techniques. So this is ultrasound, you image with mechanical waves. This is clinical breast exam, so this is palpation. This is mammography, which is X-ray, and this is magnetic resonance imaging. And we were absolutely baffled when we saw this. We were basically seeing 3 times more cancers with MRI than we're seeing with the traditional techniques. So incredibly exciting. We're really bravely going into brand new areas. Next slide, please. And what we were very aware of, but became very obvious as we were seeing these patients basically exhibit these cancers, but have them removed within a couple weeks of seeing the cancer, we would actually be able to affect their course of their life. So this is statistics from the American Cancer Society. On the bottom, we see different stages of cancers. And on the left side, what we see is the percentage probability survival for living 5 years and living 15 years. So in this population with no cancer, your probability of living 15 years is 80%. If you look at the 5-year rate, it's almost 100%. Now, if you look at a patient who has stage 0 cancer, now it's very early stage cancer and it's removed from the patient, you almost have the same survival rate, certainly in the 5-year and very close in the 15-year. So what that means is there is a way to manage cancer. It's detected early and have it removed from the body. And that's not easy necessarily. How do you get a technique to see it, and how do you transfer that information to have it surgically excised? Also very important is the other side of the graph, and this is cost. This is becoming very critical in the conditions of the economy today. And what actually works is it's economically appropriate to do screening. It's a fraction of the cost to manage a patient than if you see it at a later stage. So this really is the answer for management of cancer. And this is really what drives us every day. Next slide, please. And this is what's driven the product lines that we've developed in Toronto. And much like my discipline, systems engineering, we've taken an approach of bringing together technologies, software technologies, various imaging techniques, mechanical designs, industrial designs, RF antenna design to build a suite of products, to build technologies for some of the world's leading companies, GE, Siemens, Toshiba, building products for breast cancer detection, now prostate cancer detection, and then bringing together the ability to create these images, but then visualize them and present them in ways that no one's seen before. Next slide. And what we're seeing is absolutely astonishing in terms of the quality of the imaging that we can do. Here on the left is the first breast MRI image that was ever created. Now this was one slice of the breast, it took 5 minutes. So if you wanted to image the entire patient, it would be about an hour and a half. Now, 3 years ago, we were very excited, and this was really the start of our company commercially launching our product, that we could create an image that's obviously better, and we're able to image the entire breast in 2 minutes. So we're imaging 30 times faster with much higher quality. The next year, we were able to do that same volume in 45 seconds with significantly better image quality. And what's happening is it's almost an exponential increase in performance. And that's really what we're seeing. The only way to see it is to step back from it momentarily. Next slide, please. And that's driven us today to be able to get imaging quality in the breast that we've never seen before. We can start seeing such early stage disease that it's actually pre-cancer. And that actually causes a very difficult problem. What do you do about these early stage cells? They haven't advanced and mutated to form pure cancer yet, but they will. So we're coming up with new treatment techniques to really manage this early stage cancer, much like it was done with colonoscopy. With colonoscopy, you go through an endoscope and you look along the colon and you look for early stage polyps. And if you see them, you remove them. And that's starting to be a new paradigm for breast cancer. If you see any cells that are abnormal, you ablate them early. So it's a real new paradigm shift, and it's enabled by this type of imaging technology. Next slide, please. And the real challenge is taking that information that a radiologist would look at to diagnose these images and differentiate whether what you see is cancerous or non-cancerous tissue, and transfer that to the surgery suite. So what's different here from the previous image, this is a patient laying on her back. So we're able to now image a patient on their back, be able to acquire this image in 2 seconds, opposed to an hour that you saw 10 years ago. And what you can see here, this bright area, is where the tumor is. So we can actually visualize this in 3 dimensions and give this information to the surgeon so they can cut out this area of tissue and leave the other tissue behind. And it's really a tremendous advent and a shift in the way we manage these patients. Next slide, please. What else is very exciting is I'm talking a lot about MRI tonight, and this is probably I'd say the premier type of imaging modality. It's the most expensive. I'd say akin to, if we have any electrical engineers, it's almost a pure embodiment of Fourier mathematics. It's quite elegant in its technique. However, there's all these other ways to look into tissue. You can take many different perspectives. The traditional way is digital mammography. That's looking at the electron density of tissue. What you're doing is you're taking a snapshot with radiation. And of course, it's very low dose radiation, but everyone's very sensitized to the fact we're applying any radiation to patients at all. Ultrasound, on the other hand, is looking at mechanical waves. And ultrasound technology actually came from geophysics. They were setting off small explosives and looking at the waves going into the ground, looking for oil reserves. So there's a lot of the technology coming from geophysics that's really driven the foundation of ultrasound. PET imaging, which is very different. This is really much a pharmaceutical type of imaging technique. You can tag glucose, and you can look at how the glucose is being used in the body. And along with that glucose molecule is a radioactive tracer. So what you see here is the use of glucose in this small area, and that tends to correlate really well with cancers. What's becoming quite significant now is the use of optics, and the ability to look into very fine resolution like people have not been able to do before without destroying the tissue. So this is a very close-up view of some tissue. You see these organelles and these cells, and it's really the combination of all these technologies that really provide a full solution for management of disease. Next slide, please. This is a product that we launched this year, and it's an interesting link to the University of Waterloo. The program manager was actually a co-op student that I worked with when I was a graduate student in Toronto. Now she leads a team of 10 people, and she leads this project for our international market. It's the ability to integrate ultrasound and MR into a single modality, and there's a technology here that's made by a local company, Northern Digital, that allows us to track devices. So we can integrate three-dimensionality, and we're able to integrate devices at the same time. Next slide, please. And we've been doing this for breast cancer, and what we're able to do is present all this information in real time. The other technology we brought in is GPU acceleration. So that's actually was kicked off by another local company. It was a company of Waterloo engineers, I believe, RapidMind, and recently they were purchased by Intel. So we worked with this very small group that helped enable this with another Waterloo group driven by a Waterloo graduate. And now we're launching this product worldwide. Next slide, please. So we've taken a very different approach as a company, and it's surprising that it's unique, but we really look at the whole problem of management of cancer. And we don't just look at a single group like a radiologist, we look at all the people who are involved with that, the surgeons, the oncologists, the radiation oncologists, and we look at the problem from early detection all the way through to the treatment of the disease and even the follow-up of the patient afterwards. And it seems like a logical approach, and I think that's what engineers are, is they're logical, and there's a huge role for taking that logic and applying it to healthcare problems. Next slide, please. So we've applied this technique to women. We look at early stage detection, we looked at treatment, surgical planning, follow-up, to make sure that a patient doesn't die of their cancer. Next slide, please. And what we're seeing is really embodiment of transformations in medical care. I talked a bit about early detection, so if you detect cancer early enough and remove it, you will not die of cancer. The second piece, which I mentioned early on, is the ability to look at the genetics of a person and determine if they're at high risk for disease. So when we started applying MRI for breast cancer patients, we applied it to a subpopulation. We applied it to women that had mutation in 2 genes, either BRCA1 or 2. And if you have a mutation in those genes, you have about a 90% chance of getting breast cancer. So you can start looking at a population and start stratifying and saying you're at high risk for breast cancer, we're going to screen you every 6 months. You're at low risk, we'll screen you once every 2 years. Likewise with pancreatic cancer, colon cancer, we can really bring together a full solution for these patients. And the last piece is bringing together invasive therapy techniques where you just focus on where the disease is and treat it. So moving away from the days of resection of entire organs to treat cancer. Next slide, please. We've taken that concept, we've applied it to prostate cancer. Next slide. And it's an incredible problem. It hasn't quite reached the level of breast care so far, but we can also identify subgroups of the population that are high risk for prostate cancer and apply imaging and technologies to see where that cancer is and remove it or ablate it within the body. Next slide. We can start looking at cancer different ways. We can look at the chemical composition of cancer. We can look at this color map, and what this is the change of blood flow into the tumor over time. And we can start looking even at hypoxia, so you can look at oxygen levels in the prostate. So anywhere where there's low oxygen levels tends to be early stage cancer. Next slide, please. Actually, next slide again. So there's a lot of problems out there. There's a lot of cancers. I've talked about 2 of them. But if you do go down this list, I'm quite certain probably chances are you have had a family member affected by these cancers. So our goal as a company, and I think as an industry, is really to try to apply imaging techniques and interventional techniques that will ensure that people will no longer die of these diseases. Next slide. And that first curve that I showed you, survival rates versus staging, is the same for all the different cancers, in that if you do early stage detection, your survival rate is significantly improved. Some are much more aggressive cancers like pancreatic cancer, but the concept is still the same. If you detect a cancer early, 90% of the patients survive. If you detect it late, 10% survive. Next slide. So we are in a very interesting environment. There's a lot of hope around what we can do with imaging of cancer. There's interventional techniques and new applications. There's a lot of evidence of the efficacy of these techniques. However, we're entering a really interesting climate. It's a very cost-sensitive climate, and I'm not sure that's going to change. It used to be that there was an open a bank account in the United States for any new medical technology. That's entirely changed. Next slide. And here's one of the reasons why. So this is actually a slide from the Congressional Budget Office, and it's looking at debt as a function of GDP, or spending as a function of GDP in Social Security, external funding, such as defense, and medical, or Medicare and Medicaid. So this is the government-funded programs for healthcare. And you can see over time it was a small amount. In fact, back in the 70s, it was just a fraction. And as we go forward, it constitutes almost half the spending. So this is a disaster. This is a disaster. It's pending to happen. And that's why you're seeing very significant changes in the US to try and curb this spending. And what also you see here is a tremendous blip, and that's fundamental spending to try and get the economy back in tow. So we need to bring together technologies that are going to be cost effective and truly innovative to try and drive this growing problem. Next slide. I'm going to go through 3 quotes that were actually out last year, and this was during the really height of the economic crisis. The first one, service and finance model we previously believed needs to be reconsidered. Yeah, absolutely. It became very clear. The person who said that was Jeff Immelt, and he's the head of General Electric. Second quote, we need innovation to support our demand and continued growth. People cannot work any harder. We need technologies to give us a better level of lifestyle, and particularly in healthcare. If we're going to have better healthcare, we need technology to drive it. We can't have doctors working harder. And the last phase, healthcare technology will be a guiding light through these difficult times. And actually that was Bill Gates who said that. And in fact, Microsoft is becoming a very interested party in the healthcare problem. And actually the middle one, just to finish it off, that was Warren Buffett. So you have 3 considerable minds in the world really saying the same thing. Innovation is really what's going to drive these solutions. So next slide. So the question is, how does technology save us? And I'm going to actually skip forward here again, next slide. And you know, it's really the link of technology. Technology on its own is not going to do anything. You need to identify the problem and apply the technology appropriately. That's the core of an engineer. We're seeing really amazing developments. Lawrence Livermore Laboratories has developed a project to look at fusion. And in fact, just this week, there's incredible results from that. NASA working on ionic propulsion engines, but 2 things that were mentioned earlier, nanoengineering and quantum computing. These are fundamental, foundational shifts in technologies, and they're being done here in Waterloo, and we're really excited about what that can apply to, particularly the healthcare industry. In MRI technology, I'm going to go through a few of these very quickly, but all these technologies have a role in personalized care, early detection, minimally invasive treatment, and our abilities to finally reduce costs in healthcare. Next slide, please. Taking from our friends at NASA, the interesting technologies that were developed 30 years ago are just being applied to medicine today. Next slide. And so actually some of the technologies that got man to Mars, or at least a small explorer to Mars, are now being applied in medicine. A lot of the robotic technologies that were developed are being applied to robotic surgery and prostate surgery. Next slide. This is probably the most complex engineering project ever. This is Lawrence Livermore Laboratories. This is all lasers being focused on a deuterium pellet. This is the fusion machine. Next slide. This is some of the results from it. It's a petawatt laser, creates 14 trillion watts of energy, is focused on one spot, and that drives some pretty interesting findings. In fact, some of the optic results from this are being applied to OCT for imaging of small biopsy samples. Next slide, please. Quantum computing. I mean, very early, very complex technology. Of course, there's the Quantum Computing Institute here. But that computing power is going to allow us to look at interactions between cells, interactions between people and disease profiles, and we're going to be able to start mining this information and pulling out really dramatic information about disease on a micro and a macro level. Next slide. And nanotechnology. We actually are going to be presenting a paper in Stockholm next week. It's the first application of nanotechnology to imaging, and has the ability to significantly increase signal to noise in MR. In fact, we think it'll increase it 100 times. And what that does is we can start doing snapshot MRI. So 100-time improvement in signal to noise is going to reduce the imaging time required by 10,000 times. And in fact, the other technology associated with nano is rapid DNA testing. So they'll be able to look at the blood of a person and very quickly be able to look at what their risk factors are for health. And it sounds a lot like the movie Gattaca, a lot of people might have seen, and it's pretty close. But the ability to start applying health technologies at an early enough stage that you can actually do something to change the course of a patient's life. Next slide, please. And in my particular area of interest is antennas. So what we do in MR is we basically do very localized antennas, so we can improve the signal to noise. Next slide. Then we get these signals. So any electrical engineer would appreciate this, the free induction decay. So we can start looking at this frequency sweep of this information. And next slide. We can start processing it in the ways that astrophysicists have been doing since the 60s. And when you do that, you can start pulling out information, these medical images that people had not seen before. Next slide. And actually a lot of that work's being done here at University of Waterloo, and we're very quiet about it, but it really represents the next change and the next epoch in all of medical imaging. So great science, exciting stuff, but what does that mean? Next slide, please. In our particular area in MR and detectors, next slide, we can take these concepts, these very large array antennas that are out in the desert, and we start applying them to very high density coils for imaging a brain or body, or high density transducers for ultrasound. And the results we're getting from is absolutely phenomenal. And what's a bit embarrassing, and I think people in the MR world are a bit embarrassed, is that we're pulling out papers from 40 years ago and applying it. And it was just sitting there. It really could have changed the face of medicine if somebody would have looked in the right journal at the right time. Next slide, please. And what that translates to us is very high density coils. We're able to do snapshot imaging of breast imaging and take this expensive technology and now apply it to the general population. People previously said breast MRI doesn't have a chance to replace mammography because it's 10 times more expensive. But just the simple concept of getting dense antennas around the tissue has reduced that to only 3 times. And that has a very significant impact on not only the financial aspect of healthcare, but of course everybody's lives. Next slide, please. Also pulse sequences. Next slide. Now, dare I put a Fourier transform up here, but this is an image on the left of a animation of a body. This is the frequency domain information from that image. So this is what you'd see, and if you were to invert everything, this is what you'd see in frequency domain. And a very interesting concept, and one of these, I'm not sure which one, it's not Terry Tao, one of these is the University of Waterloo graduate in mathematics, came up with this idea that you don't need to get all the frequency information to create an image. You can randomly sample, throw 83% or so away, and create the same image. So next slide, please. So an image of a heart. Heart, of course, is very difficult to image, particularly in MR. It's beating, can't slow it down, so you need the image very quickly. And on the left is a slice through the heart, and this would be an image, I'd say, about a 10-second image, so it's a little bit blurry. The idea is if you could speed it up an image every second, you sacrifice your image quality. But if you apply this new technique called compressed sensing, you can image 20 times faster. And on the right is this image subtracted by this image, and the human eye sees no difference. And that's really what matters. You care about if the radiologist sees a difference. And this technology is immediately transforming the way we're looking at acquisition of image technology. Next slide, please. And being able to image really fast then allows us to image areas that are very difficult for MRI to image, like the lungs. So these are in fact lungs imaging, and this is a very small cancer. This is a 5-second image without using radiation of early stage cancer. So like you can look at the blood of a patient to see if they're high risk for cancer. You can also look at their lifestyle choices. So you can start applying a screening technique to patients who, or to citizens who might have smoked previously, and start doing a screening program so they don't die of lung cancer. So that's the power of technology. Next slide, please. And moving outward of there is somebody who was bold enough, everyone would told me in MR, there's no way to image bone, it's impossible. Well, this is imaging bone using MRI with the new pulse sequence. And you can actually see things in the tooth in early stage decay that there's no other way. A field strength war out there between all the big companies, moving from 1.5 Tesla, so I think that's 150,000 times the strength of the Earth's magnetic field, to double that, 3 Tesla, to new systems that are 7 Tesla. And what that does is allow you to image with greater resolution and be able to image chemical species that you could never see before. The problem is this costs $1 million. This is almost $40 million. So next slide, please. But what that does is allows us to start looking at resolutions and details of tissue that we were never able to achieve previously. Next slide. And so what does resolution do? Well, it lets us resolve tissue. It lets us differentiate between tissue in a way that we couldn't previously. This is a lymph node zoomed in, very small. It's about 8 millimeters or so. And it's actually hard to differentiate whether it's a healthy lymph node or whether it's a cancer. But when you apply high resolution, so this is imaged twice the resolution in each direction, all of a sudden you can almost see it. It's a lymph node that's almost out of a pathology book. So you can start differentiating between tissue in entirely unique ways. And of course, the next step is working on automated techniques to mine this rich data and be able to help computers assist the doctors in their diagnostics. Next slide, please. And this is the last section, is your therapy monitoring. And then I know there's a very strong link with the University of Waterloo and in downtown Kitchener with the pharmacy building, pharmacy department. And in fact, this role of pharmaceuticals and imaging is part of one of those trials that we're running out of the University of California, San Francisco. And it's actually the biggest NIH trial ever run. Next slide, please. And the purpose of this is quite simple. It's using imaging in an entirely different way. What we see here is a very large tumor. The prognosis of this patient over 5 years is very poor. It's about 20% chance of living past 5 years. And what's shown down here is actually the 4-dimensional imaging, so the imaging of the blood flow over time, mapped into color so you can better represent it. So what we're seeing is red areas are very active areas of tumor. What we see here, it looks like the same patient, but everything's green, so the tumor's a lot less active. And what was done between here and here is administering a chemotherapy drug. And you think, well, why are you giving chemotherapy before you've removed the tumor? And this is the new concept, is you can actually leave the tumor in the body and give a dose of chemotherapy to the patient, hope that you get the right chemotherapy and the tumor will shrink, like we see on this side. So the right agent was used, 2 weeks later it shrunk the tumor, and all of a sudden, if this tumor is excised in this patient, the 5-year survival rate for our patient goes from 20% to 70%. Fundamental shift. And what imaging allows us to do is quantitate this. So we can give a tool to the oncologist to tell them how to select their drugs for that patient. And that's really the embodiment of personalized medicine. And we're doing a 25-center study where this is being rolled out. What's very exciting, even beyond this, next slide please, is the role of this technology in drug discovery. Next slide. So in fact, using this tumor as what we call a biomarker, as a way to measure the responsiveness of this tumor for a drug, you can actually go through drug discovery much more effectively. So you can try different drugs on the same patient. So traditionally, to do a randomized trial, what you're trying to do is get a big enough population of people that you can normalize out for any variations between the population. Optimally, you'd like the same tumor in the same person to be able to do a proper experiment. And of course, that's not possible, except now we can do that with imaging. We can run the same experiment in the patient to see the responsiveness of that tumor to the specific drug combination. And what that does is it's anticipated to reduce drug discovery costs by a factor of 10. And when we looked at that curve of that phenomenal growth of Medicare, Medicaid, that's a function of a lot of the research and development that needs to go into solving these medical problems. And by reducing the cost by a magnitude of 10, that is a very significant effect. And actually the person who developed this algorithm is a University of California graduate, but did their, I believe it was their systems design engineering graduate a few years earlier than me, but 1990. So you can see how impact can be made throughout medicine in so many really fulfilling ways. Next slide, please. One more, please. So our hope, I think I can probably speak for everyone here, our hope is that these technologies can be combined in appropriate ways to provide optimal patient care, that we can really solve a lot of these problems that have been causing people pain for a long time, cancer, heart disease, and so on. And our hope is that, like our friends at NASA, this technology can help propel us to an entirely new perspective on care. So next slide, please. Where we can take a different perspective. The slide that I love is, of course, the perfect different perspective to the Earth rise from the moon. So thank you very much for your time tonight. I went through a lot of material there, so I'm happy to answer any questions that you have.